First, I'd like to thank the Foundation for selecting me as the 2019 recipient of the Charles Mérieux Award for Achievement in Vaccinology and Immunology. When I look at a list of the prior recipients, I am both humbled and inspired. When I first learned of the award, I felt a bit of a fraud because I always thought the vaccinology as the study and development of vaccines, and I do neither. I'm a user of vaccines. So I was gratified when talking with Gary Marshall, who gave the Stanley Plotkin vaccinology lecture at the Infectious Diseases Week last year, when he explained to me that he had the same concerns, but he ended up saying that to be a vaccinologist, all you have to do is believe that vaccines are an important public health intervention and you have to do something about it. So I was quite reassured by that. Second, I'd like to apologize for not being in Baltimore to receive the award in person. The World Health Organization's Strategic Advisory Group of Experts on Immunization, or SAGE, is meeting currently in Geneva, and among other things, they're discussing a project that I'm working with WHO on. So I unfortunately need to be there. I'm particularly sad not to be in Baltimore because I understand that Bill Schaffner is moderating this event. And I first met Bill more than 50 years ago at CDC, and we've been close friends ever since. Over the years, one of my great interests has been in the control, elimination, and ultimate eradication of measles, as well as rubella and congenital rubella syndrome. 36 years ago, Don Hopkins, Jeff Copeland, Mike Lane, and I wrote a paper called The Case for Global Eradication of Measles. Since that time, there has been a lot of action, including the development of a measles and rubella strategic plan, the endorsement by the World Health Organization of the concept that measles can and should be eradicated. A lot of progress has been made, and global targets have been set up to achieve elimination of measles from all 6 WHO regions by the year 2020. We've made a lot of progress, but this year, we're having a resurgence of measles in many parts of the world, in part as a result of complacency, vaccine hesitancy, which has been identified as one of the 10 top global public health threats of 2019, and a lack of concern and political will in many developed countries. So we're seeing more measles this year than we did last year or the year before. But nonetheless, we need to keep in mind that we have had an 84% reduction in the number of measles deaths just since 2000. And we have saved approximately 20 million measles deaths during that period. Here in the US, we're also seeing a resurgence of measles, and there's a lot of debate going on about whether to strengthen school immunization laws by reducing exemptions, or to increase exemptions and thereby weaken the laws. I'm pleased to say that in general, the strengthening laws arguments seem to be winning. Social media have made it possible for anyone to say anything about a given topic, whether it's based on science or just assertion. And it's difficult to know which to believe sometimes. People seem to ascribe to the view that comports most closely to their own. Notwithstanding the fact that we've got a resurgence of measles, I am comforted by the fact that we're talking about a total of currently between 200 and 250 cases of measles in the US. Before measles vaccine became available in 1963, we had about 4 to 5 million cases of measles every year because every child in the United States developed measles by the age of 15, and we had between 4 and 5 million births a year. So that's the number of actual cases, even though most of them were not reported. We have got some problems now, but I remain optimistic, and I believe that measles eradication is inevitable. I only hope it will occur in my lifetime, and since I'm now 82, we better get started on it. Thanks again for this wonderful award.